most important applications of ultrasonography in canine reproduction are in the early detection of pregnancy and the diagnosis of uterine pathology. This video production demonstrates how a routine ultrasonographic pregnancy diagnosis can be performed. It also illustrates on which criteria the diagnosis can be based, and it shows some of the dynamics of intrauterine life of the canine fetus. Although it is not always necessary to shave the abdomen, the quality of the ultrasound images is usually much better when the hair is removed from the mid-ventral abdominal wall. Shaving is most easily performed with the dog in the supine position. The use of coupling gel on both the skin and the transducer allows maximal transmission and receiving of the ultrasound.
Oma.
Here the dog is scanned while lying on her back. However, in most cases, a standing position is equally suitable as long as the animal feels comfortable. The scanner should always remain within the reach of the examiner so that image quality can be adjusted. The following images have each been obtained from the same beagle, which delivered 6 puppies on day 62 after a single mating. Unless stated differently, a 7.5 MHz linear array transducer was used. In all cases, the abdominal wall is at the upper side of the image. The scale on the left is in centimeters. The fluid-filled bladder appears as a single large black spot. By slowly moving the transducer over the abdominal wall, several conceptuses, the so-called ampullae, appear as fluid-filled local swellings of the uterus. They clearly appear to have some contents, although at this stage of development, the embryo itself may be difficult to recognize. This mainly depends on the frequency of the transducer. In fact, this is about all that should be visualized to diagnose a pregnancy. One day later, the size of the ampullae has considerably increased, and on a longitudinal view, they appear as an oval shape. The embryo and the yolk sac are now prominent. On the inside of each local swelling, it is still the entire surface of the uterine wall which is covered by the placenta. At a higher magnification, one ampulla fills the whole image, and a heartbeat of the embryo can be recognized. With the bladder on the left side, conceptuses appear in transverse or longitudinal views. When the transducer is at a more cranial site of the ventral wall, the typical parallel lining of the intestines appear. Here, the yolk sac and one border of the zonary placenta are visible. At this stage, the ampullae elongate by the outgrowth of the non-villous allantochorion at both poles of each implantation chamber. During a laparotomy performed on day 29 after mating, the pregnant uterus has been exposed. The typical size and shape of the 6 ampullae can now be observed directly. In a longitudinal view of one fetal sac, the yolk sac, umbilical cord and the fetus itself appear at the same time. In this almost transverse section, the amniotic membrane can be seen to surround the fetus. Also at about day 29, the first fetal body movements can be recognised, but usually only during more prolonged scanning. After day 30, the amount of fluid in the yolk sac decreases, giving this fetal membrane a more flattened appearance. It is located at the mesometrial side of the fetus and extends between the 2 poles of the ampulla. Movements of the head and limbs can now be clearly discerned. When the fetus moves through the plane of the ultrasound beams of the transducer, the outline of its head becomes clearer. In the thorax, the beating heart is clearly visible. In longitudinal view, the head, heart and umbilical cord appear. Between days 30 and 40, the volume of fetal fluids reaches a maximum. This allows the fetus to move quite freely. One of the front legs kicks against the underlying fetal membranes, which they start undulating. The big black spot represents allantoic fluid. These images show a fetus in longitudinal view with its head to the right. Because the scanning takes place very slowly, the fluid-filled bladder and the thorax with the ribs and the beating heart can easily be recognized. Even the lens in one of the eyeballs becomes visible. After the 5th week of gestation, the local swellings of the uterus have completely disappeared. Because of the great amount of fetal fluids, the uterus is more evenly dilated and its wall fluctuates when touched. Due to the large volume of the uterus, small penetration depth of a 7.5 megahertz transducer, it becomes impossible now to obtain an overview of even one complete fetal compartment. Therefore, a 5 megahertz transducer, in this case again a linear array probe, is preferable during the second half of gestation. With the dog in the standing position, scanning starts at the mid-ventral area. In this longitudinal view, the length of a fetus is about the same as the width of the image. The two border zones of the placenta indicate the width of the placental girdle. It is obvious that at a lower magnification, less detail can be discerned. Movements of the fetus within the amniotic membrane are many. Using the 7.5 MHz transducer, the skull and jaws can be recognized by their more intense echogenicity. Note the movements of the lower jaw. The following scene was obtained during a phase with very slow scanning. The thoracic walls with the ribs, the liver and the intestinal mass are easily recognized. At the caudal side of the fetus, one of the hind limbs and the tail are visible. The tail is curved, so that its tip can be located on the ventral side. The femur of one of the hind legs in longitudinal view. Again scanning the anterior part of the fetus, the thoracic limb and aorta can be recognized. In a split screen setting, on the right, one of the image lines which cross the fetal heart is selected so that its echoes can be presented in M mode on the left image. By placing markers over two of the recorded heart cycles, as indicated by excursions of the ventricular wall, the heart rate is automatically calculated. In this case, 222 beats per minute. In this detailed picture of the head, one of the eyeballs and even its lens can be seen. Within the cavity of the mouth, movements of the tongue are obvious. We will repeat this last scene once again. During stretching of the front legs, one of them becomes visible in longitudinal view. Note the individual toes. A very clear border between fetal thorax and abdomen is indicated by a marked difference of echogenicity. During the final weeks of gestation, fetal breathing movements occur, but they can usually only be observed during more prolonged scanning sessions. In this case, a series of hiccups can be noticed. Note the localization of the fetal stomach, which is filled with amniotic fluid. As early as 2 weeks before the end of pregnancy, fetal preparation for birth is well on its way, as can be estimated by several behavioural characteristics. Movements of the tongue and the lower jaw, like here, are just a few of the criteria which might be of interest in this respect. After day 50, most of the morphological features of the development of the conceptus, as illustrated in this video, have been completed. However, because dog fetuses are relatively small and always within the reach of a high-resolution transducer during transabdominal scanning, ultrasonography may also form a valuable technique to study the functional aspects of fetal development in more detail. This is what needs to be done in the coming years.
Medical, dedicated to the development and manufacture of diagnostic ultrasound instruments, is in the vanguard of companies that have contributed to Holland's worldwide reputation as a high-tech nation. One of the best-known applications of ultrasound is in obstetrics, where fetal age and well-being can be monitored, bringing reassurance to both doctor and patient. The final check before shipping is only one of the several quality control steps that every system undergoes during the various stages of production. But everything starts with the development of a new scanner. Essential to the process is a close communication between our engineers and the specialists in universities and hospitals. Pi Medical's task in meeting the user's needs is made easier by exploiting the investment that the company has made in state-of-the-art CAD/CAM technology. Our highly qualified engineers develop a software that becomes even more sophisticated as we strive to keep pace with the demands of the medical profession while maintaining user-friendliness. During every stage of assembly, every scanner part is thoroughly checked. Every component used must, of course, conform to the demands described by international regulations for medical devices. Transducer production combines high technology with a watchmaker's precision. The final product is tested once again for both function and image quality, the last of many rigorous tests before it has earned a signature for release carrying Pi Medical's name. Collaboration with leading physicians has given Pi Medical unrivaled expertise in medical ultrasound applications, an expertise made available to all our clients. The interaction between development, production, assembly, test, and after-sales service has assured a range of high-quality ultrasound scanners appreciated by both staff and patients. With an eye for detail in design and using the latest cost-effective production methods, one can justifiably claim that our products are state-of-the-art in ultrasound technology. Over the past 18 years, the company has established a worldwide network of over 80 highly trained and qualified dealers who guarantee first-class support in both medical applications and technical service. Pi Medical, a proud Dutch manufacturing company headquartered in Maastricht and today one of the world's leading independent ultrasound specialists.